Hello, good morning, Sitaram, and welcome to another program in the series, Addiction and Recovery. I'm your host, Ram Naresh Dwarika, as usual, welcoming you every Thursday morning on radio and TV Jagriti. To this, another very important program this morning, I will be talking about popular misconceptions about alcoholism and drug addiction. Because, you know, from my experience, there's been a lot of misunderstanding about alcoholism and drug addiction. And because of this, a lot of people are baffled, sometimes confused. So today I want to address one of the most dangerous obstacles to recovery, and that is misconceptions about alcoholism and drug addiction. These false beliefs, what happened? They create a lot of shame, they create denial, and they also create stigma. Sorry about that. And they also delay treatment as a result. So that in Trinidad and Tobago, these misconceptions are especially powerful because alcohol and drug use is socially normalized. Hold a second, let me sort this out. Yes. And public health agencies like the World Health Organization and recovery fellowships, such as Alcoholics Anonymous, agree that misinformation keeps people sick and education saves lives. So today I want to expose some of these popular myths and replace them with facts, which is supported by local data. Okay, misconception number one. One of the popular misconceptions is that alcoholics and drug addicts are weak, they are immoral, and they are bad people. And the truth is, addiction is a chronic brain disease affecting judgment, impulse control, stress response, and decision making. And in Trinidad and Tobago, over 64% of households report at least one member consuming alcohol in the past year. Now, more than half of those households report heavy episodic drinking. I think it goes without saying that a lot of people in Trinidad believe that you can't have a good time without drinking. It has become literally woven into the social fabric that, all our celebrations, we're using it to celebrate Christmas, we use it to even mourn when you have a wake and all of that. If we win the match, we have to drink. If we have any kind of get together, not only in Trinidad, I've seen this with the diasporic community as well. Caribbean people in the United States, in Canada, where I've traveled, whenever there's a get together, there seems to be, it is very, very observable. You can't help not seeing it, the presence of the alcohol and the drinks and so on. Now, this tells us that addiction is not about bad character. It is about exposure, it is about biology and behavior patterns. So that addiction is not a moral failure, but recovery does require responsibility. So, what I'm saying, in spite of the social pressures and the popularity of drinking and drug use, not everybody who drink will become alcoholics or addicted to it. But everybody who drinks, everybody who became alcoholic, they started with that first drink. So that it is important to educate yourself. And once you realize that you have a high risk, you come from a family with a high prevalence of alcoholism and so on, that you are at more risk. And it becomes your responsibility to do something about it. So that, you know, there are other misconceptions. For instance, they believe that, look, if you got sufficient love, if your family loved you sufficiently, and express that, that would make you stop using drugs. That love should be enough to stop using drugs. And a lot of family members use that to bargain as a bargaining chip. Look, if you don't stop, I'll stop talking to you. Wives would say that, sometimes parents, relatives, I will have nothing to do with you. I had a relative in here yesterday morning whose daughter is using a psychotropic drug. And to get them to come, you had to tell them, well, look, if you don't go for treatment, I'm not going to talk to you again. Those things may probably precipitate the onset of treatment, but it will not sustain it. So that love shouldn't, it is important to express your love and your concern. But the truth is, addiction overrides emotional bonds. And a lot of people who have had family members who were addicted to drugs can attest to this, because, this is one of the reasons addiction is described as an emotional illness. Because even though your head is telling you that, look, this is wrong, I need to stop using, you are so tied up. When there's a struggle between the intellect and the emotions, usually the emotions win out. So that the emotions here is the depression and the fear of the withdrawal symptoms and all override the intellect and the judgment. Local data shows that alcohol use is widespread across families and not isolated to individuals. So that in a lot of families, I come from a family where I got so much love, to the extent where that might have, precipitated my drinking. Because, one of the reasons people drink or use drugs is because they want to feel good, and they want to feel good right now. You understand? They have a difficulty postponing gratification. And that in itself could perpetuate drinking and drug use. So that heavy drinking often occurs in loving family, loving homes as well. And this explains why a lot of people, guilt is not sufficient to cause a person to seek help, sending them on guilt trips or begging them to stop. I have seen family members promise all kinds of things. I had not too long ago a brother promising another brother he'll buy a car for him if he stopped drinking. And that didn't, yes, the person stopped for a little while just to cash in on the promise, but that didn't sustain it. And then threats of separation from spouse, threats of putting you out of the house, and all of that. Threats, they may cause a person, like the threat of, okay, you're going to get fired from the job, may cause a person to seek help initially. But these do not produce lasting change. Addiction requires treatment and structure, not emotional pressure. And that is important to understand. So that let us look at misconception number three, that only poor or uneducated people become addicted. Now, nothing could be further from the truth for those of us who work in the field of drug addiction. You know, the myth is that addiction is a problem of the poor and the marginalized. Well, not so. Yes, that might be a contributing factor. But the truth is, substance use in Trinidad and Tobago cuts across all social classes. And let me explain that. You know, a lot of people who live in the posh areas and so on, the upper and middle class folks, they they also become addicted, but they are not as visible because they could afford to go abroad for treatment and go to posh rehab centers, and they can cover up their problem very easily. But the poor person has no choice. They even eventually they are exposed to public view. So that, and just to back this up, among secondary school students, you know, a survey that I was part of many years ago showed 66.9% of students at the secondary school level, they report a lifetime during their lifetime, they would have used alcohol already. They were already introduced to alcohol. And 28.8% report cigarette use. They would have experimented with it. They would have tried it at least once. And 16.5% report having tried marijuana as well. And this is in the secondary school system. Cocaine and heroin use, though lower, are also present in some isolated instances. Because I used to be president of the National Council on Alcoholism and Drug Addiction. And we did a lot of work in my time with secondary schools, primary schools, and so on. We will be invited by schools to do presentation on alcoholism and drug addiction and so on. And so we even started a peer counseling program in some of the schools so that, you know, the friends in the class are the first ones to be aware that one of their colleagues, one of their friends, classmates, they're hiding and using the alcohol, they're bringing it, disguising it and bringing it and so on. So this is why peer counseling in those schools were very, very effective. Now, this means with that kind of percentage in the school system, what it really means, it implies that addiction risk begins early and affects every community, rural, urban, wealthy, and working class. It cuts across the board. You understand? Because children, let me say this, I've said this before, children are not only curious about geography and history, they're curious about everything that they see. And they will want to understand it. They will want to, and children generally are very daring. You know, they always like to test boundaries, especially when they reach to the age of teenage and so on, when there's a sense of rebellion where you tell them don't do this. Well, they want to know why. They don't quite believe you. They have to go and find out for themselves. So that, and as a result of that, experimenting with the drug, that's how most people start, out of curiosity. Indeed, I myself, you know, wanted to try it. And when you have had that first one experience, you never forget because we have memory. It stays in our memory and it is always brought again, retrieved. That piece of experience is retrieved and we remember how it felt when we had that initial contact with alcohol or cigarette or drugs. And later on, when we are stressed out by what's happening in teenage, like, you know, you have the pressures of exam, of developing an identity, your hormones kicking up, now your attention is turning to the opposite sex, and all of those kind of confusing things that are happening during those years, and this is when a lot of people who would have started using drugs out of curiosity earlier on or were introduced by relatives or friends, they now start finding ways to use it to help them to cope. And it is no surprise the media and social media and all of that keep advertising these things and glorifying them in some instances so that it perpetuates the use and the dependence. So let's look at misconception number 4, that a lot of people say you have to hit rock bottom before you could recover. And that's a popular thinking, which bears some truth to it, but it is not absolutely necessary, because I am seeing a lot of people now not having to reach rock bottom to decide to do something about themselves, especially intelligent young people are now realizing, look, if you're doing the same thing the same way, you cannot expect a different result, and finding themselves in trouble. So that the myth is that people must lose everything before help works. That's not true. The truth is, waiting for a person to hit rock bottom can literally kill them, because you can overdose and die in a single situation. So that in Trinidad and Tobago, it is estimated that 31.6% of children aged to 15 years report having used alcohol. The same percentage report having been drunk. This shows that children are now being exposed very early, and it leads to normalization. And this is because of normalization, because what are children seeing? The children are seeing that when family come, we bring out the drink. Christmas, Carnival, Easter, you name it. Holidays, celebrations, weddings, wakes. It's alcohol. So alcohol has become a normal um, part of living in Trinidad and Tobago. And this early exposure, when the brain is now developing, especially with drugs like marijuana and so on, it increased the long-term risk of becoming dependent, of suffering brain damage, of developing dependence as well later on in life. So that recovery is more effective, just like any other illness. If you catch it early, recovery is much more effective when started early and not after devastation. Unfortunately, a lot of people don't come to see me until they hit rock bottom. And when they come, sometimes they are brought by relatives. And like the person I referred to earlier on, who were brought by the brothers, and they're saying, well, look, what's the point in stopping now? I don't have a parrot and a stick. I don't have no children. I don't have this. I don't have that. All I have is this alcohol, which has become like a crutches, like a person who suffered a broken leg and had to be using crutches to walk around, now become dependent on the crutches. So once the leg is not fixed, and they know after falling a few times that they can't walk without the crutches. And that is, you know, a fit analogy to explain what happens here. So that recovery, just like any other illness, if you catch it early, it can prevent years of devastation and destruction. And some people become so damaged, both physically, psychologically, emotionally, that it becomes more and more difficult for them. But the irony of this is that a lot of people are not willing to do anything when it comes to drug addiction until they hit crisis. And for a lot of people, the crisis is only when they reach to the point of almost death. So let us look at misconception number 5. A lot of people believe that relapse means the treatment has failed. You know, the myth here is that relapse proves recovery doesn't work. And yes, I have seen that. And I've heard people report and family members throw up their arms in the air and say, look, we fed up. nothing can work. I think he's resigned, consigned now to either the prison or the cemetery or the mental hospital. Because yes, without intervention, those are the three places that you'll end up: either prison, insanity, or death. And but relapse is a symptom, not a verdict. I want to repeat that. Relapse is a symptom, it is not a verdict. And in countries like Trinidad and Tobago, where alcohol is culturally accepted, drinking is part of celebrations and access is easy, so that the risk of relapse is much higher, especially without long term aftercare. Relapse means treatment needs adjustment. Relapse also means that support needs strengthening, not abandonment. And this is what I impress upon my patients when they come to see me. Even though, you know, alcoholism is a disease, but it is a disease where sometimes relapse becomes part of recovery. And let me explain that. Sometimes people are not quite convinced, or some people are so dependent that they can't believe that they could manage or exist without the alcohol. So that, yes, the temptation is so great, the urges become so powerful that they relapse in spite of all their efforts. However, those are opportunities for the therapist like myself to work with the person and help them to recognize, literally do a post-mortem of their relapse, so that you can see where you were, what was happening, what was going on in your mind, or maybe what was it in the environment or inside of you in your mind that triggered that relapse. And if you do that, then you can develop a strategy so that the next time, like I did with a patient this morning, we looked at his last relapse and we looked at, okay, what was happening at the time. And yes, I would have told them several strategies when they get the urge, what they should be doing. Like I will share that with you all now. If you in recovery and you're getting the urge to to drink, for instance, what you need to do is drink something sweet. Keep your stomach full. Pray and ask God to help you to get over the urge. Um, Talk to somebody. Call your sponsor. Remove yourself from that situation. Pray and ask God to help you. You know, and the person said, but I didn't do it. I forgot all of that. I didn't do any of that. Let me correct this. Right. Are you hearing me? Okay, I think we're having a little problem with the delaying of this. Yes. Anyway, we were speaking about relapse. I'm sorry about that. Sometimes you have these technical little problems. So that a relapse can be an opportunity for the therapist to look at what was happening and educate the person, help them to develop insight. And yes, some people, yes, you might say they didn't quite believe you in the first go. So sometimes relapse become necessary to let them know that, hey, you can't do it your own way. You have to do it the way I'm telling you to do it now. And eventually they make it. So let us look at misconception number 6. I've listed 10 of them this morning. Hopefully, you can get through all of them. And this one is that you can force someone to recover. That is, you can pressure them, you can threaten them, or you can give them ultimatums that cause recovery. The truth is that, as I said earlier on, could cause them to seek help. Yeah, a crisis, create a crisis for them. could cause them to seek help. But sustainable recovery must be internally motivated. Yes, they may go to seek treatment because they are afraid they'll lose a job, or that the wife threatened, I will leave you, or she has left and refused to come back. So that, yeah, these things may initiate recovery, but the therapist, it becomes the responsibility of the therapist, the counselor, to help the person. It doesn't matter what brought them to treatment, but you need to work with them and help them to develop insight so that they could make connection between their behavior and their drug addiction, that they start taking responsibility and stop blaming other people, and they literally commit to staying sober. And that is what eventually they have to want to do it for themselves. So long as they're doing it for the mother, father, wife, employer, and so on, that will not be sustainable. Because the first day they have a quarrel with the relative, they will go back. Or like in the case I described earlier, once they get reward you promise, well, there's nothing more to motivate them to continue. So they'll go back and use. So that what families can do is encourage treatment. Okay, you may want to say, boy, aren't you supposed to go to a meeting this evening? Or, you should stay away from those kinds of friends. Let's do something together. Let's go somewhere. Let's, do something healthy. However, in that process, you need to set boundaries. And what I mean by setting boundaries, and this is what will include and stop enabling the person. Now, sometimes with all the love and care and concern we have, we could literally be enabling the person to continue to use. And let me explain that. Person using drugs, getting themselves into trouble, getting in trouble with the law, for instance. And yes, you go on paying the lawyer and you paying the fines and all of that, because they're seeing the immediate problem is they're trying to avoid going to prison. But so long as you don't treat with the underlying drug problem, they will continue to go and drive without a license or insurance, or they will drive under the influence and get themselves into other trouble again. And besides that, what we need to understand is that some of these drugs, marijuana, for instance, they affect the person's reasoning ability. It makes them impulsive. The frontal cortex is gradually damaged so that their judgment is impaired. And they are not able to sustain decisions. Recovery must be accompanied by discipline. You make a promise to yourself and you have to be able to keep it. But once a person is using drugs, they are unable to keep promises, even promises that they make to themselves. There were many, many days I would tell myself, look, if God's help came, I'm not going to drink today. And an hour or two later, I am gone. You understand? You can't even keep a promise to yourself. And it is because of the dependence, because of the withdrawal from the drugs, so that they really can't control the outcome. Family members, we could encourage people to go to treatment, but we really cannot control the outcomes of it. Family support fellowships such as Al-Anon, family groups, they help relatives learn how to support recovery without controlling it. So that in Al-Anon, one of the first things you learn is that, look, the person has become addicted to the alcohol, but because of your addiction to them, because of your love for them, the alcohol is controlling both of you. So you can't really control them, just like the person, the alcoholic, cannot control alcohol. They have to accept they can't control alcohol anymore. So too, you have to accept I cannot control this relative of mine. Because a lot of families suffer tremendously because they're still trying to control the alcoholic or the drug addict. And they don't have a life of their own anymore. I've seen parents, I've had to tell parents so often that, look, you can't control the person. That your son or your daughter is an adult now. All right, you speak to them, you let them know that, look, if you decide to stop using drugs, you have 100% of my support. But if you decide to go back and use drugs, I can't support you. And having said that, those are the boundaries I'm talking about. If you say, look, if you continue to use drugs, you cannot stay in this house, then you better be willing and able to carry out that promise. If anytime you renege on that, the person is going to know that you could be manipulated, and whatever you say in the future will have no force at all. So that don't make promises that you can't keep. Another misconception is that, and I have seen that once detox is done, the problem is solved. Because a lot of family members, they remember, that person before they started to drink or use drugs was such a nice person, was so obedient, was such a kind, and all the good qualities. But the drug is what is the problem. That is what has transformed the person. And what happens, they believe now as a result. Now, once you could get the person to stop, once they stop, they're going to be good. Well, no. The myth is stopping the substance equals recovery. No. The truth is, detox only addresses physical dependence because dependence is of different sorts. You have people who have become physically dependent. They must take that drink, otherwise their hands shaking, otherwise they're going to hallucinate, or they're going to become depressed or anxious or irritable and all the other things. And once they take it, you know, those things will be mitigated. However, those are only physical withdrawal. A lot of drinking is only one of the symptoms of this disease. I keep saying that all the time. There are other symptoms like low self-esteem, poor coping skills, self-centeredness, selfishness, all of these things. So that all of those have to be addressed as well. Otherwise, the person's sobriety and recovery will become precarious. So alcohol remains the most widely used substance across communities in Trinidad and Tobago. Social pressure often leads to rapid return to use. Yes, they will stop for a little while the crisis exists, but as soon as the crisis is over, they'll go back. True recovery requires counseling, and if I say that sustained counseling, not just one session, two sessions. A lot of people think in Trinidad, in the Caribbean generally, that everybody think they could be a counselor. Anybody, any good Samaritan. And a lot of people, yes, they, even religious people and all of that, but they are not trained in the discipline of counseling. Counseling requires fixed, and rigid disciplines, controlled emotional involvement. The client has the right to self-determination. You have to be able to make evaluation, and you have to be objective, so that professional counseling and sustained counseling is required. It also requires lifestyle changes if a person is going to stop and stay stopped. It also needs peer support. So they cannot go back and line with the old friends who used to encourage them to drink. Now, if they join AA, they go to the temple and all of that and get in company with people who will encourage them to stay sober, they're more likely to remain in recovery. And to do this, it is also important that the family members educate themselves. And that is what this program is about, week after week. I know a lot of times, very few percentage of alcoholics or addicts themselves are listening to this program. A lot of family members I know, they meet me all the time and compliment me for the work that I'm doing here. And I want to say at this stage, I consider it a privilege, a God-given privilege to be able to do this because of my own experience, been there, done that. I have a passion for this work, and I'd really like to be able to help my brothers and sisters out there to stop using drugs. But I know it is the family members a lot of times who are listening to the program and and hopefully educating themselves so they could understand. If you have a member of your family who is addicted, who has become dependent, now if you understand the problem, you are better able to deal with it. So that peer support, especially from groups like Narcotics Anonymous, Alcoholics Anonymous, because these fellowships, they specialize in treating drug addiction and helping people in recovery. They are populated by people who are in recovery and who have had the problem and they are now staying sober, and they can identify the pitfalls of even recovery and help the new person. This is why there's an active, what is called a sponsorship program in Alcoholics Anonymous and Narcotics Anonymous. So let us look at misconception number 8. Medication is just replacing one drug with another. And yes, I have also held that view for some time in the past. But let me correct myself here. I am aware that sometimes you have to use medication. Medication assisted treatment, some people see that as cheating, but medication reduces craving. However, as I say that, yes, in the initial stages, you may need to use medication to avoid the person going into hallucination and acute withdrawal symptoms and so on. The problem with that, however, is that a lot of we Trinidadians are sometimes too smart for our own good. We look at the name of the tablet that is prescribed, and we realize that when we drink, we could use this to help us deal with the withdrawal, and so that we start self-medicating. You understand? And let me say this about medication. Medication, when they're developed in certain fixed amounts, like 2 milligram, 5 milligram, 10 milligram. And they are tested in laboratories with extensive research, but they never test these things on people who are intoxicated. They're usually tested on people who are sober. So that you don't know if you're combining alcohol and the drug, you can not only put your brain to sleep, you can put your heart to sleep and you can die. So that, and what happens with my experience in this field is that a lot of people start using the medication in conjunction with their drug use. And now that becomes doubly hard. When they stop the alcohol, they can't get off the medication. But I have now had the responsibility with my patients to help them. And thank God we have acupuncture now that can be used to help people to come off the medication that they have become dependent. And if I say so, I've had quite a number of people who work in the health fraternity, doctors as well, who have become addicted to medication. I've used acupuncture to help them to come off it. So that while initially in detox medication, while I work at Cora, St. Anne's, and so on, yes, they use medication to assist in the initial stages. With the introduction of acupuncture, there's a less and less reliance on medication assisted treatment. And yes, medications can prevent relapse in the initial stage, especially if the person is not in a rehab center, in a protected environment, if they're out there in the community where the drug is available. Because when the withdrawal symptoms become so acute and they have the money and it is available, they can't seem to resist the urge to go and get it. And while also it can prevent relapse, it can lower the risk of overdose. Well, that can work both ways, because if a person is using it in conjunction with the drugs, then the risk of overdose increases. So that while it can be a God gift in one, it can become a poison in the other. So, in a society with a high school availability of drugs, because children are now, I don't mean to suggest the children what they should do, but I know children are finding all kind of very, very innovative ways to sneak alcohol into the school and go behind the building and drink with their friends. And they see it as being an adventure, how they could beat the system, and they think they're having fun with it, you know, because alcohol is still available, and in spite of all the laws and so on, children still find ways to get alcohol if they can't buy it directly. And I know there are some unscrupulous rum shops that will sell alcohol to minors, teenagers and so on. And there are, of course, teenagers who manage to switch the alcohol from the parents' um, private bar and fill it with other substances and so on, and help themselves to it and carry it to the school and so on. Anyway, enough of that. So that because of early exposure, and there's a strong social drinking norm, medication can become a life-saving tool and not enabling. Now, that one I would say with a caution, because I have found generally, and I will speak to this in another program, that in Trinidad in particular, they progressively have become a more and more a heavy reliance on chemotherapy. And this is having implications not only for alcoholism, but for so many other lifestyle diseases, for instance. Look at the amount of people who are diabetic and hypertensive and obese and all of that. And and they are now being put on medication. But hypertension and diabetes is not caused by viruses or bacteria or anything like that. It is because of lifestyle. And there's no pill or medication that can cure your lifestyle. Only you could do it by changing your attitude and behavior, so that one has to be careful on, and it becomes a heavy responsibility on our medical practitioners, that when we're prescribing medication, any medication, that we have a plan, a treatment plan that allows for the person to come off the medication. But far often I'm hearing patients reporting, well, the doctor say, I will have to take this for the rest of my life. Well, I would say if you have to take a medication for the rest of your life, it means that you will never get better. You understand? And people are accepting that look, I will never get better from diabetes. I will never get better from hypertension, which is, to my mind, and I'm saying this, is not true. I have seen a lot of patients, a lot of people who make adjustment to their lifestyle and have now not have come off a high blood pressure medication and diabetes medication and all of that. So let's go to misconception number 9, that people in recovery are always unreliable. And this is something, I've heard people say very glibly, once an addict, always an addict, which is true. You don't ever get cured, but that does not mean to say that you will always be untrustworthy. Yes, a person in addiction, one of the first casualties of addiction is trust. So people stop trusting you. But my experience is that people in recovery often become much more accountable, because now they're taking responsibility for themselves. And if you look at the 12-step program, for those who are following the 12-step program, one of the first step is that you have to become honest. And you have to become honest with yourself. And to be able to accept your responsibility for whatever, it takes a certain amount of humility, ego deflation, so that the first step to recovery will introduce a person to a life and of becoming more and more honest and humble. And as a result of being honest with themselves, they now become more honest with other people. And of course, gradually, the family is able to trust them more because they are able to share more. I encourage people who are addicted to let the family know what you're going through so that now they can understand. So that when you get the urge, you can go and say, Mom, Dad, I'm getting the urge to use, or this is what happened. And you be honest with them. And this is how they will start trusting you. If you're running late, please call home and tell your wife, well, look, girl, I'm running late. Because from the time she see 5 o'clock when you should be home from work and you're not there yet, the first thing that will go through her mind, oh God, he gone back drinking again. Because that was your pattern in the past. And you would unknowingly, unwittingly put her through the ringers, the emotional ringers, so that by the time you get home, you have maybe you had traffic or some accident on the road that caused you to get delayed. And yes, she may come to kiss you on your cheek, but she'll really want to smell your mouth to see if you went and drink. And you will pick up on that, and that will start the quarrel. You're already frustrated from work and the traffic and all of that. And now you come home to a wife who doesn't trust you because of the way you behaved in the past. And now you know that she's literally telescoping to you that, she can't trust you by coming to smell you out. So these things take time. Fellowships like Narcotics Anonymous emphasize responsibility. They emphasize service. They also emphasize personal integrity. In AA, a lot of people learn to start looking out for each other, stop being selfish and self centered, so that recovery often produces stronger individuals than before addiction. And I've seen so many people in recovery eventually rise to their full potential, you know, as a result of stop drinking. And finally, let's deal with misconception number 10, that addiction is hopeless. Once addicted, there's no real recovery. And I've heard the locals saying, once a dog starts sucking egg, they just can't stop. And I've heard wives tell husbands that, poor fellas trying to stop drinking, and they would put you down. And family members as well. The truth is, hope is supported by evidence that despite high exposure rates in Trinidad and Tobago, many individuals recover. We have almost 120 something AA groups in Trinidad. We also have a sizable amount of Narcotics Anonymous groups as well. And there are thousands of people who have recovered over the years because of Alcoholics Anonymous in Trinidad and Tobago. So that many individuals do recover and families heal and communities rebuild. They become better workers. They become, I have stopped drinking. It is 42 years, 2 months, almost 3 months now. And I have become involved in my community. I've worked in several service organizations over the years, National Council on Alcoholism, and with the NCIC, and so many other places. Hopelessness delays treatment, but education restores hope. So that in conclusion, I want to say why correcting these myths matters. It is important that we understand these myths and correct these misconceptions, because when myths dominate, people hide because of the stigma. And families cover up for them. They enable them to continue because they don't want anybody to know, because of the shame and the guilt they feel. And as a result, treatment is delayed. And treatment delayed could cause the death. So that when facts replace myths, help is sought earlier. Families respond wisely. Recovery rates improve. So that addiction is not a moral failure and recovery is not a miracle. It is a process and it works. And I would like to say I'm evidence of that. So I want to thank all of you who have been listening up to this point, and to remind you this program was recorded this morning and it will be posted on Facebook and YouTube at the end in a few minutes. It will also be repeated on radio and TV Jagriti tonight at 10 p.m. And if any of you have questions, of course, my number is on your screen, 671-3040, or you can text me at 768-5925, and I'll be happy to respond to your questions, your comments. And I welcome, any comments on Facebook and YouTube. I look at them. And of course, this program is presented as a public service by Radio and TV Jagriti Fraternity. I want to thank the operators there and the CEO for giving free airtime to our brothers and sisters worldwide to educate and enable them to do something about drug addiction. Alcoholism and drug addiction is a disease, but it is a disease that can be arrested one day at a time. And if you or anyone you know do have a problem with alcoholism or drug addiction, or suspect that you might have, you can call the numbers on your screen, and I'd be quite willing to respond and assist in any way I can. So I want to thank you again, and until next week, Thursday, when we will join each other again for another program in the series Addiction and Recovery. And thank you again.